Good.
I know you're here to know more about how to check the blood sugar, also about insulin. How long you have been diabetic for?
10 years.
Okay, so have you been taking metformin and sulfonylurea, right?
Yeah.
Okay, yeah. So I'm glad you're here to know about more about the how to check your blood sugar and insulin. What question you have for me?
How exactly do you check my blood sugar?
Okay, there is a machine called glucometer. It's like a tiny handy kind of mini computer like stuff. So you just have to wash your hands with the soap and water and then put your finger. It's like a mosquito bite. It's not really scary, sounds scary, but it's not really painful. So get a drop of blood and put it in the tip of the strip, and you will get the result right away.
What do you think is the best way to check my blood sugar?
Because it is always good to know what is your blood sugar, and then so also it also show you different kind of food and activities, how to affecting your blood sugar. So it's kind of mechanism of action, happen inside the body.
Is there anything I should be careful about when I use this, like eating certain things?
Oh yeah, because all the carbohydrates, especially rice, pasta, then pizza, all those things raise the blood sugar. So we have to be keep on watching the diet, what are we eating. Also the physical activities, help to maintain the blood sugar. But always make sure physical activities or exercise it is really important in the part of taking care of the high blood sugar.
How long would it take for me to see results?
You will see the result right away. That's a good thing with the glucometer because when you do labs, it will take longer. But then this one, you will see the result right away.
What are some warning signs I should watch out for?
Oh, yeah, because when you start taking the insulin, it is always good to know how do you differentiate between hypoglycemia, that is low blood sugar, and then hyperglycemia is the high blood sugar. So if you feel like you're sweaty, confused, not feeling well, very fatigued, like altered mental status, that means you're having low blood sugar. On the other hand, if you're feeling like very tired, if you feel like you're peeing a lot, or otherwise you're very thirsty, that means you're having high blood sugar. So both of the cases, you have to let someone know in your home. Otherwise, if you need any medical care, you need to go to the urgent care or call the doctor's office, please.
Do you have any advice for me to make sure I could use the tool?
Oh yeah, at the beginning, everything is kind of difficult, but practice make it better. So, once you start doing that, you'll be used with how to do the blood sugar. It's not really hard. Also, very important. It is it is super important. You have to keep a log of the blood sugar numbers, like what number you're getting it. So that's a way. You can see the patterns. Is which food is making the blood sugar going high and which food is lowering your blood sugar. So it is always good to keep the log.
Will my insurance cover for it, and how much will it cost?
Health, since you have a health insurance, you have, right?
Yeah.
Yeah. So since you have it, I'm sure it will cover, but it's always good to check it before we start the treatment. So we'll help you to do that, and then so I'm sure it will be covered, but always make sure it will be covered.
Oh, I understand the blood sugar meter now, but you also mentioned something about insulin. What is it, and how does it work?
The insulin, it's just like we put the gas in the car, right? So that's the one helps the car to run the same way. If the mechanism of action is that when you give insulin, when you eat something, your blood sugar level will be high in the blood. So since someone is diabetic, they don't really have enough insulin to move the sugar from blood to the cell for the energy. So in that case, we give insulin from outside. Like additionally, we have to give insulin, so it helps to move blood sugar from blood to the inside the cells.
Why?
So that's a mechanism of action.
Why do I need this insulin?
As I said, we don't really need any hyperglycemia. It's not going to help. So we need the blood sugar to be maintained in the healthy way. So that insulin helps move the high sugar from the blood into the cell for the energy. So when you work something, you need more energy, right? So it helps. So that's a mechanism of
Is
action.
there any other special thing I need to know about insulin, like eating late or taking other medicine?
Oh yeah, definitely. Because if you take insulin and if you have planned to eat and but if you skip a meal, that means your blood sugar will be going down. So you have to be careful about that. And moreover, do not take overdose or underdose of insulin. Just do the thing whatever the doctor advises you to do it. And also exercise every day, like just keep an eye on how much you like how much time you spend for exercise. And also keep a log on that for the blood sugar, so you will see the pattern of insulin, like which food is raising your blood sugar, what activities you can do it, and check your blood sugar and take your blood sugar almost at the same day. That is also really important.
When will I feel the insulin working?
Insulin work right away, but there are different kinds of insulin: short acting, long acting, intermediate acting. So once we recommend the insulin to you, then I'll talk more about it. Then I'll help you to make sure you understand.
What are some red flags for insulin?
Oh yeah, that's really important. There are some red flags on the insulin, like the risk factors, because insulin can give you the hypoglycemia, right? As I said, I mentioned earlier, like if you're feeling really fatigued, like it's sweaty, not feeling well, that means your blood sugar is going down. That is called hypoglycemia. And make sure you eat some candy or juice, orange juice, something with a carbohydrate right away. So it will help you to raise the blood sugar. And moreover, the other factors, when you start giving the insulin, you have to make sure you're rotating the side. You can give it on your both arms, on your thigh, on your lower abdomen, but you have to make sure you're rotating the side. That's the way you won't mess up this tissue.
Any tips for taking insulin easily?
There is like yeah, as I mentioned at the beginning, everything sounds scary, but like it should be easy when you're doing it. Like practice make it better. So tips are keep a log, changing the side. So mainly that's the two things you have to
Will
remember.
my health insurance cover it, and how much does it cost?
As I mentioned earlier, the glucometer and insulin, since you have insurance, it is going to cover, but we have to find out the cost. I'll help you to do that.
Okay, I think I understand a lot more now. When would you like me to come back to you again?
Okay, yeah, I would like to see like between 2 to 4 weeks, so that's the way we can be on the track. Okay, so I'll teach you more about how to give insulin and then like what kind of insulin you are taking. So according to that, I can give you more education about that. Thank you for coming. So it was nice talking to you,
You're
Mr.
welcome.
John. Thank you. Mm, mm.